One doesn't have to look far in the US to see that most people take serious issue with how our healthcare is handled in this country. Many individuals on both the left and the right constantly complain about the rising costs of medical expenses, co-pays, medications, pre-existing conditions, and medical bankruptcy. Most of us see the problem in it, but few actually understand what a viable solution would entail because most let their preconceived biases around the world supersede their objective reasoning. Irrespective of one's political views on the topic, if we as a society are going to continue to persist, we need to take an objective stance on the issues of politics and economics. And rather than get caught up in the tribalism, we need to ask the question, what is the system that best maximizes happiness, sustainability, efficiency, and good public health? In other words, what is best? And hopefully, after this exercise, you and I will see eye to eye. Unfortunately, due to a massive propaganda campaign here in the US, there's a red fear that has been instilled in the people to believe that having any sort of public health policies centered around cultivating, facilitating, and nurturing human life is somehow a bad thing, and it takes us further in the direction of dictatorship. When the truth is that every time we have been more socially inclusive of others, every time we have expanded the democratic process, the standard of living for everybody tends to improve. So in this exercise, we are going to talk about why our healthcare system, free market healthcare, privatized healthcare, or capitalist healthcare, whatever you want to call it, has failed us in every conceivable way and does the opposite of maximizing happiness, sustainability, efficiency, and good public health due to the reckless pursuit of increased profits at all costs. Proponents against single-payer healthcare tend to want to handle this issue the same way they want to handle most. Just let the free market fix it. Let private companies have proprietary say and control over life-supporting commodities. The theory is that a competitive free market is constantly trying to provide the best services and goods at the lowest possible prices, and that profit is the measure by which you do that. Effectively, the assumption is that any business that practices unethical behavior will go bankrupt because if they charge too much, if they're rude to their customers, if they try to rip people off or provide inferior service, then people will simply go to their competitor. In pure abstract theory, this is what the assumed result is. But is that true? Well, let's look at what the data has to say about that. Most modern nations on Earth use a single-payer healthcare system. However, here in the United States, the native homeland to many transnational corporations, the common man finds himself having to fork over a couple $100s every month or so that he can oftentimes have a company cover only some of what his medical bills cost. Many right-wing talking heads will say free healthcare is too expensive. However, the fact of the matter is that in the United States, the epicenter of private health insurance firms, spends more on health insurance per capita than every other modern nation on Earth. And the cost of health insurance is only getting more expensive over time once adjusted for purchasing power parity. The following chart is showing the trends in healthcare spending country by country in the last 2 decades, ranging from the years 2007 to 2016, with respect to the country's percent of GDP. Well, what does this mean? Well, the gross domestic product is a measure of the total expenditure on goods and services in the economy. In the year 2016, the United States spent $3.35 trillion on healthcare, a 5% increase since the year prior, 2015. That is an average of $10,000 per person. Now, from a market economic standpoint, this is a good thing. It means more money is being spent to circulate into the economy. But is this technically a good thing? More on that later. It is a fact that the US pays more for its healthcare than any industrialized nation on Earth, and in spite of that, we rank 37th in the world for overall healthcare efficiency, according to the World Health Organization. Let's take that and compare that to our neighboring nation of Canada, who ranks 30th on the list. It should be noted that Canada is not a pure single payer, and that they do have supplemental programs on the private market, but for the sake of this essay, they are a fitting comparison. According to a meta-analysis done from ncbi.gov, the US citizens pay nearly twice as much per capita as Canadians do, and in spite of this, we have higher rates of infant mortality and lower average lifespans by almost 3 years. And they are able to achieve greater efficiency than us in spite of having fewer staff in their hospitals on average. In addition, we here in the United States also pay more for prescription drugs than any other modern nation on earth. In fact, according to this chart from the Organization for Economic Cooperation and Development, we spend $1,112 per capita on prescription medication, while the mean cost per capita from other countries around the world is $484. That means per capita, Americans spend an average of nearly 2.5 times as much on drugs than the rest of the world. And these are just my own calculations. In most cases, the prices are significantly higher than that. To quote an article from Scientific American, U.S. prices for the world's 20 top-selling medicines are, on average, 3 times higher than in Britain, according to an analysis carried out for Reuters. The 20 medicines, which together accounted for 15% of global pharmaceutical spending in 2014, are a major source of profits for companies including AbbVie, AstraZeneca, Merck, Pfizer, and Roche. Researchers from Britain's University of Liverpool also found U.S. prices were consistently higher than in other European markets. Elsewhere, U.S. prices were 6 times higher than in Brazil and 16 times higher than the average in the lowest priced country, which was usually India. The United States, which leaves pricing to market competition, has higher drug prices than other countries where governments directly or indirectly control medicine costs. Due to the increasing costs of prescription drugs, more and more Americans are beginning to have their prescriptions imported from other countries. According to polling from the Kaiser Family Foundation, 8% of Americans have their medicine imported from other countries. That's as much as 19 million people. Other methods people are using to save money include simply not taking their medication as prescribed, or skipping doses, asking for a discount on meds, and seeking alternative therapy. And yet another tactic people are using to get by due to overpriced healthcare is procrastinating on care altogether. There was a Gallup poll done from the years 2001 to 2014. 33% of insured Americans polled are skipping doctor visits due to outrageous costs of copay. Failure to pay for healthcare can result in debt being sent to a collection agency, causing damage to your credit. Bad credit can prohibit you from getting a car, a house, or even a job, thus creating a negative feedback loop in which you cannot pay your bill due to being trapped in the cycle of poverty. It doesn't end with the collection account, however. The collection agencies can garnish your wages for unpaid medical debt. Each creditor is allowed to garnish up to 25% of your paycheck, or 30 times the federal hourly minimum wage. However, if you've visited multiple hospitals, have debts from multiple creditors, and it can all stack together to the point that you can accrue 100% wage garnishment. While this level of highway robbery is rare, it still occurs, and there are people out there who owe upwards to most, if not all, of their paychecks to creditors. As a result of the rising prices of healthcare and medicine, this type of debt is becoming more and more common to the point to where the number one cause of medical bankruptcy in the United States is medical bills. In fact, based on data gathered by the Kaiser Family Foundation, as much as 58% of people having problems paying their medical bills are basically harassed by creditors. 35% have troubles getting their basic needs met because of said medical bills, and as much as 1 in 5 people who are behind on their payments or are having trouble making their payments end up having to file bankruptcy. This becomes even more frustrating when you realize that wage garnishment in bankruptcies declared could be due to fraudulent charges. In other words, you could be losing pay or going bankrupt to medical billing fraud. Medical billing fraud is yet another serious issue that goes on here in the United States that is rarely, if ever, addressed by any independent journalists, let alone any major news outlets, let alone any politicians save independent candidates like Ralph Nader. According to the National Healthcare Anti-Fraud Association, $68 billion are lost every year to, but not limited to, overcharging patients for medical services, charging for services never approved by the patient, typically through identity theft, performing unnecessary procedures solely for the purpose of charging more, unbundling, also known as billing each step of a procedure as if it were a separate procedure, falsifying a patient's diagnosis to justify tests, accepting kickbacks for patient referrals, and waiving copays from patients so they can overcharge the insurance companies. Other estimates put the amount of money lost in fraud at about $230 billion a year. But even those estimates are quite conservative. Malcolm Sparrow, an applied mathematician at Harvard University, estimates medical billing fraud adds up to a minimum sum of $270 billion a year, or as much as 10% of all healthcare expenses. He discusses the sinister nature of this racket in his book, License to Steal. So is it really true that the market is trying to bring us higher quality goods at lower prices when it's clear, based on what the trends show, that the average American net pays substantially more for inferior healthcare than citizens from nations abroad? When Americans are having to find themselves looking for alternative medical treatments, importing their prescriptions from Canada, skipping doses to save money, and procrastinating on care because it's too expensive to afford? In reality, the purpose of a business, any business, is profit above all else. The measure of your success as a firm is directly correlated with how much money you make, and anything a firm can do to secure more market share, regardless of the ethic, it will do so, especially when every other firm on the competitive market are doing the exact same thing. If you don't play ball, then you'll lose. If you try to do something ethical as a business, like pay your workers more or produce superior long-lasting goods, then sorry to say you're not playing ball. Not only will your profit margins decrease, but shareholders will stop investing in your company. And this point leads us into the next section of this exercise.
Due to the structure of a capitalist economy, making money is the priority of any business. There are three main ways that businesses maximize profits under free market healthcare. Number one, denying care to whoever and whenever they possibly can. Number two, charging as much as possible for healthcare services. And number three, lobbying the government to accommodate their gaming needs. Have you ever heard of a pre-existing condition? A pre-existing condition is an ailment that the patient has prior to seeking healthcare that can either be congenital or acquired. Prior to the passage of the Affordable Care Act, health insurance companies denied care based on pre-existing conditions. They did not differentiate between acquired or congenital. Pre-existing conditions include, but are not limited to,
HIV/AIDS, alcohol or drug abuse, Alzheimer's, dementia, anorexia, arthritis, bulimia, cancer, cerebral palsy, congestive heart failure, coronary heart disease, bypass surgery, Crohn's disease, diabetes, epilepsy, hemophilia, hepatitis, kidney disease, renal failure, lupus, mental disorders, multiple sclerosis, and muscular dystrophy.
in other words, the people who need care the most are most likely to be denied health care. The reason for this is because the insurance company can save money by making you pay the total amount out of pocket rather than fork over their end of the copay. Another method in which hospitals use to save money is what critics call patient dumping, which is
a statutorily imposed liability that occurs when a hospital capable of providing the necessary medical care transfers a patient to another facility or simply turns the patient away because of the patient's inability to pay for services.
In addition to denying you coverage wherever and whenever possible with arbitrary rules, they also have a direct incentive to charge you as much as possible. Insurance rates in the US generally average around $250 per month as a rough estimate. But the truth is that the cost of insurance is on the rise across the country, as well as the cost of the average deductible. In the year 2017, even with the Affordable Care Act in effect, the entire country experienced significant hikes in premiums. If you go to any government website or news outlet on the topic, virtually all of them will tell you that prices are skyrocketing. The reason for this is because, as stated before, the priority in the for-profit market is to make as much money as possible. It doesn't matter if you leave your current plan to go to a cheaper competitor because they're all competing to raise the prices more by the year. The higher the prices rise, the more people get priced out of the market, the less people can afford health insurance, and the more people can't afford to go to the doctor. And as a result, it's no wonder why that, according to a study done at Harvard University, nearly 45,000 people die every year because they can't afford basic medical services. We're not talking about knee replacements or heart transplants. We are talking about not being able to get their basic medical needs met, such as getting prescribed medications or going in for health exams. The only thing that is keeping this system from imploding in on itself at a rapid pace is state regulation. Originally, the Affordable Care Act, or at least a plan very similar to it, was put together by the Heritage Foundation in the late 1980s as a Republican alternative to single-payer health care. Essentially, it was a federal mandate to purchase health care on the private market with some laws protecting consumers. The positive accomplishments of this bill include, but are not limited to, temporarily halting premium price creep, establishing protections for those with pre-existing conditions, allowing young adults to stay on their parents' plan until age 26, stopping insurance companies from denying you coverage or charging you more based on medical history, and expanding Medicaid to cover more people outside the poverty line. Unfortunately, even Obamacare isn't perfect though, as it only exists to serve the market and keep things in some degree of relative order in a system as volatile as ours. It still leaves millions uninsured because there are those who exist in an economic gray area who don't make enough money to afford health insurance but make too much money to qualify for Medicaid. And now the uninsured rates will be back on the rise since what little stability provided by Obamacare is being dismantled by the current orangutan-in-chief and his criminal gang. President Trump is set on doing away with the individual mandate, protections for those with pre-existing conditions, cutting Medicaid spending, and removing the state lines between companies so they can move to the states with the most lax regulations. And of those goals, he has completed the first. Under President Trump's healthcare plan, the Committee for Responsible Federal Budgets calculates that as much as 20 million people are projected to lose their health insurance over the next decade, and the deficit is expected to bloom by as much as $480 billion. Now, how's that for the party of fiscal responsibility? So you have those on one side of the issue who believe in controlling the free market beast with regulations to make sure some degree of order is kept, and the system actually functions somewhat like it's supposed to. Then on the other side, you have those who think capitalism needs no rules, and everything will work itself out if you just have this laissez-faire type policy. Neither side recognizes the problem that there is an incentive and reward to deny people coverage, commit fraud, and upcharge for medication and services to begin with, and that is because both Republicans and Democrats are paid by various groups of lobbyists to keep the whole charade going. It's no secret that lobbying in Washington goes on to the tune of countless billions of dollars every year. And it's also no secret that the pharmaceutical industry and private health insurance companies are part of the problem. Money and power go hand in hand like bread and butter. Within the last 20 years, the pharma companies spent $4 billion to influence Congress, and the insurance industry has spent nearly $60 million in the year 2012 alone. Effectively, they have sought to it that they get the best end of the deal at all times. With this in mind, it should be no surprise to anyone when our politicians refuse to do anything meaningful to fix the problem with our healthcare and only pay lip service and spout rhetoric on the campaign trail. It should also be worth noting that candidates running for Democratic office are not legally obligated to uphold the promises that they may have made on the campaign trail to their constituents. Now would be a fitting time to return to the point iterated earlier with respect to healthcare spending and GDP stated prior. The United States spends twice as much of its gross domestic product on healthcare services as a majority of the economies on the planet. But is this a good thing? What does spending $2 trillion a year on medical expenditures actually entail? And from a market standpoint, would it be better if this number rose to, say, $4 trillion? Well, yes it would. More circulation, more jobs, more growth, and as boasted by economists, more progress. The fact of the matter is that GDP is not a good metric to measure public health because it represents the money people are spending to recover and stay alive. If people were getting healthier and actually doing better, then shouldn't the demand for medicine and medical procedures actually be decreasing over time? There is a dark truth underlying this sinister economic mode that is never addressed. And that is, for this to happen would be financial suicide for the medical establishment. Hypothetically, let's say a cure for all cancer was discovered tomorrow, and this cure was made of simple elemental components that were in relative abundance, such as hydrogen or calcium. And this medicine has an unsophisticated manufacturing process and could be mass-produced quite easily. If cancer were cured this quickly overnight, then the economy would take a serious hit. Jobs would be lost and GDP would drop since not as many people need treatment for cancer anymore. Here's another example. Heart disease. The number of people who are contracting heart disease has increased, but the death toll has gone down. I shall cite two articles from CBS and Science Daily to illustrate this point.
CBS. The number of American adults with heart failure, in which the heart is too weak to pump blood throughout the body, rose by 800,000 over 5 years, the American Heart Association said in a report released Thursday. The number of people with heart failure is expected to rise by 46% by 2030. That means 8 million people will have heart failure by then. Reasons for the rising number of Americans with heart failure include an aging population and a growing number of heart attack survivors who are at risk for heart failure. However, one bright spot in the update is that the deaths from cardiovascular disease fell more than 25% from 2004 to 2014. In 2013, cardiovascular diseases were the leading cause of death worldwide, claiming more than 17 million lives, the association said.
What this means is that in spite of the fact that more people are contracting heart disease than ever before, the death tolls from the disease are decreasing due to new medications to treat it. There is a lower sum death toll in spite of the rising rates of heart disease. But why? The truth is that there is a great deal more money in treating illnesses over curing them. If someone is cured from a sickness, they don't need to keep coming to the hospital for medication. So from a market standpoint, it makes more sense to develop treatments and patches over cures. And with the rise of heart disease globally, an illness mainly caused by environmental factors such as poor diet, smoking tobacco, a sedentary lifestyle, and stress, there's going to be a big market for prescription cardiovascular medication. This creates a perverted incentive structure, which increasing profits at all costs is antithetical to public health. If the current medical establishment were in the business of improving public health and curing diseases, then in a sense, they would be in the business of putting themselves out of business. Debunking endlessly cited single-payer prats. Number 1, single-payer healthcare is too expensive. That is not correct. I just got done explaining that we pay more per capita than any other nation on Earth, not only for prescription drugs, but doctor visits and medical procedures. Not only have I presented the stats to prove that to your satisfaction, I also have the data to prove that
A comprehensive, nationalized healthcare plan would save the public trillions of dollars. According to the research funded by the far-left communists we all know and love, the Koch brothers, the Sanders Medicare for All plan would net save the public over $2 trillion over the next decade. And this is just a conservative estimate. A more recent study done by the Political Economy Research Institute based in the University of Massachusetts found that with respect to the Sanders Medicare for All plan, over that same time span, $5.1 trillion would be saved in public spending on medical expenses. This means that over the next 10 years, U.S. citizens would be spending between 2 and 5.1 trillion less dollars. Taking the average of the 2 trillion and 5.1 trillion figure, ignoring population growth, that means the average adult American will be spending $14,200 less over the course of the next decade, or $1,420 less per year on average. So yes, your taxes will go up by a marginal amount, but you'll save thousands of dollars over the course of your life, get better care, always have access to care, and not have to worry about going bankrupt due to medical bills. Number 2, wait lines are way longer under the single-payer healthcare. Not completely true. Oftentimes you'll hear right-wing hacks criticize single-payer for such issues. Their favorite example is Canada. It is true, on average, Canadian citizens need to wait longer to get their procedures done. In fact, it is a problem they recognize and they're working on it. However, it should be important to caveat this with the fact that majority of the waits are for non-emergency and elective procedures. An example of this would be a cosmetic surgery or a knee replacement. If the treatment is essential to someone's life support, then wait times in Canada is actually comparable to that of the US. In addition, there are single-payer systems in other countries that are far more efficient than Canada. Wait lines in Norway, Germany, or Japan, for example, are not an issue like in Canada, and yet they use a nationalized healthcare plan. So if other countries are able to make the system work just fine, then why can't we? Number 3, healthcare services are rationed under single-payer. Dishonest framing. This is one that I've heard a million times on mainstream news, and even from people I've talked to in real life, as though healthcare rationing doesn't go on in free market healthcare. Irrespective of the system, the issue here is scarcity. Under private healthcare, hospitals conduct a form of medical procedure called a wallet biopsy, which is defined by the medical dictionary as a a cynical term used in fee-for-service healthcare systems for the assessment of a patient's wallet for insurance coverage information to determine whether he can pay before admitting him to a hospital or performing expensive procedures.
In essence, the quality of care is determined by how much money the patient has. Irrevocably, those with better insurance plans end up with the procedure. The system is inherently biased towards those with the best plans, and that doesn't necessarily translate towards people who need care the most getting access to it when they need it.
Hypothetically, a hospital could have two patients who need a kidney. One has a month to live while the other has 6. And the hospital ends up giving the kidney to the person who has more time just because he or she has better insurance. In addition, hospitals are biased towards those with cheaper insurance. Having a cheap plan is the medical equivalent to having bad credit. The patient will be charged significantly more for procedures as a result of cheap insurance since they're considered a risky investment. They almost anticipate that since you cannot afford better insurance, that you won't have the money to keep up with hospital bills, so the co-pays end up being higher than if you had a better insurance plan. The patient with the most money will have the most access to medical services as opposed to those who need them the most. Number 4. Healthcare in other countries sucks compared to the US. No. Increased access to medicine and healthcare services will do nothing but improve public health as a whole. A healthy populace is a happy populace. Healthy people are able to work and contribute their talents to the betterment of themselves and the rest of society. I'm sure we can all agree that this is true, and we can have that. All we need to do is develop a new social precondition which has this interest in mind. Here's a chart from the World Health Organization ranking countries on their efficiency of their healthcare with respect to the following variables: health, health inequality, responsiveness level, responsiveness distribution, and fair financing. The countries that rank above us have overall lower rates of infant mortality, higher life expectancy, greater satisfaction rates with care, fewer fatalities during procedures, and no fatalities due to lack of health care. Number 5. Without the profit motive, you won't be able to incentivize companies to innovate and create pharmaceuticals. Wrong again. Pharmaceutical companies seldom do their own research. Oftentimes that research is publicly funded to higher learning institutions where these medications are discovered and invented. The pharma companies simply come in, buy the patent for it, and sell it as though it were their own creation, often at times at outrageous prices to the point to where people end up dying because they can't afford it, or pay out most of their earnings just to stay alive. An article from ABC News outlines this point well, and I quote, "A new report shows taxpayers often foot the bill to help develop new drugs, but it's private companies that reap the lion's share of the profits. In one case, the federal government spent $484 million developing the cancer drug Taxol, derived from the bark of Pacific yew trees, and it was marketed under an agreement with Bristol-Myers Squibb starting in 1993. The medical community called it a promising new drug in the fight against ovarian and breast cancer. Since then, Bristol-Myers Squibb has sold $9 billion worth of Taxol worldwide, according to the General Accounting Office report released today. The National Institute of Health have received just $35 million in royalties from Bristol-Myers, however. Bristol did not discover the drug. The federal government did, with taxpayer dollars, and then negotiated a licensing agreement with the pharmaceutical giant. The Medicare program alone paid for nearly $700 million over a 5-year period to buy the drug the government helped to develop." Now, in a world that makes sense, if the public is funding this research, they should be getting returns on their investment in the form of socialized medicine. Private companies shouldn't just be able to come in and take credit for work other people do. For those of you who think it takes a competitive free market to develop more efficient goods and technology, know this. Innovation is a communicative process where new discoveries in the scientific community are compounded onto one another over time. Nobody just arbitrarily invents machines or cures for diseases. We discover them based on prior knowledge and research. And within the market, there is a great incentive to hoard patents to secure market share. After all, if you know something nobody else knows, then the last thing a firm wants to do is release that knowledge, because now your competitors can turn around and improve on your design and sell something better than you. This, ironically, stifles innovation, as being able to share information and discoveries with one another has always been what allows true scientific progress to come to fruition. In summary, what does it say about our nation, the supposed richest and greatest country in the world, when our healthcare system is so broken that tens of thousands of people die every single year of preventable ailments, when people have to start GoFundMes to finance their medical bills, when people have to order medicine from other countries because domestic meds are sold at an outrageously inflated price, when people skip out on care because they cannot afford it, when the public is conned out of billions of dollars every single year due to medical billing fraud, when hospitals dump patients to save money, when patients are treated as safe or risky investments by hospitals based on their medical coverage, when private health insurance companies have a list of arbitrary excuses to deny sick people care called pre-existing conditions, and when, in spite all of these shortcomings, the average person net pays more for coverage than any other modern nation in the world that has nationalized their health care. Now, if you're a hardcore right-winger, I'm sure you'll disregard all these inconvenient truths and continue to spout the endlessly debunked prats pertaining to single-payer and proceed to brand me a socialist or say something about Venezuela because you're too lazy to think deeper about the problems at hand. It's interesting how you types are so afraid of the tyranny of big unchecked government, and yet more often than not, you're welcome to concentrated unchecked private tyranny. Well, let me tell you something. The cost of insurance is on the rise. The number of uninsured people are on the rise, and by extension, the number of preventable deaths due to the lack of basic medical needs are on the rise. This system cannot sustain itself forever and clearly doesn't work. As long as profit remains the driving force behind the way we manage our resources, you will see problems like this arise because at the pinnacle of this system is the dollar. The only logical conclusion here is that unless we nationalize our healthcare and treat it as a basic human right rather than a commodity, this slow grind of unnecessary death, suffering, and exploitation will only continue to get worse until it starts to affect everyone, including the wealthy. That is, since these private health insurance firms, for-profit hospitals, and pharmaceutical companies aren't against cannibalizing the rich either. The facts are on my side, so you can either accept them and remain honest, or reject them and remain an ideologue.